Hello. It's a pleasure to be here, as Jake is saying. So, me first, when I read the theme of this year, Facing Forward, I thought future. But then I went back and read what Kwame Nkrumah was referring to. It was more about blocks, east and west. And now we have this bicycle and the direction, it's east and west. It can be the time, it can be the blocks, it can be the directions. And when I think about it, it always amazes me how great the human mind is, how we can play with words as Yvonne did earlier on. And it also brought me back some few years back when I was in the United States during an exchange program. And I had a great time there, and I had friends who would have good time together, not knowing where I was coming from. And when suddenly they asked me, "Where are you from?" I say, "I'm from Rwanda." And they will come up and ask me about one of these movies. "Have you seen this movie?" "Which movie?" And he would tell the story about the genocide against Tutsis in 1994. And to me, it appeared that for him, Rwanda was 1994. So as the world kept moving forward, Rwanda for him had stopped at that specific date. It's like the clock had stopped ticking for us, but continued to tick for others. And it brings back all this relativity, how people think, how people see things, how perspective can be different, and how the human brain can be different but complementary. And I will tell him, you know what, the clock didn't stop ticking in Rwanda too. We continued to run our time, and we made things. People pulled themselves together. People united, and people built the country. So things changed. We built the country. Things changed, things are happening over there. Things are happening over there in multiple sectors, the health sector, the agriculture, education, ICT, and so many other domains that are evolving. And roads, infrastructures, and everywhere there's constructions happening in Rwanda. So we are moving forward. And talking about roads, it reminds me another story about some of those friends that I had in the US, especially. They will come and tell me, "So what's the capital of Rwanda?" And I will say, "Kigali." And he will tell me, "You know what? I have a friend in Lagos." and they say, "Do you know him?" I was like, "Okay." And the funny thing is that I said, "No, you know, it's kind of far, Lagos, you see. Africa is a big continent." And he would understand it. He said, "Okay," he compare it to the US. And he said, "Okay, so how many hours drives from Kigali to Lagos?" And with all the constructions that we are having and all the good things that we're doing, probably someday I will be able to answer to him and say, 2 hours. So maybe fast forwarding to get to the health sector, the one that I'm mostly familiar to, things happened in Rwanda. And one thing, from where we came from, we have a priority of giving to people the best life that we can give to them. So health is key, is a priority. Especially that, we have 70, 80 years to live, to be happy, to be healthy and productive, when we are lucky at most. So one of the engines of our development is the human capital. We're counting on people to make things happen. We're counting on people to move forward. And counting on people means make them lead healthy lives and educate them. Because when you have somebody who's educated and who's healthy, he's necessarily productive. And when he's healthy and educated, you don't need to spend any money on his health, because health costs a lot. So that's how the idea of establishing a community-based insurance came up. The community health-based insurance in Rwanda is, as it says, it's a health insurance that targets all the households. So it's per household. Everyone in Rwanda has to have a health insurance, being the community one or another one or any other or private. But you have to have a health insurance in Rwanda. So the community health workers, besides targeting the household, it has to be, you have to subscribe to it every year. And for the poorest of our population, because there are some population who are still very poor who cannot afford the community health insurance, the government subsidizes it for them. So the government will pay the premium, and the government will pay also the co-payment when they go to seek care. So that we are sure that all our people, the wealthy and the less wealthy, get the care, the basic care that everyone needs. But, and then it bears fruits. It bears lots of fruits. It started in early 2000s with a coverage of 7%, and in 2011, we had a coverage of 90%. So that was amazing. The other thing is that when you give people financial access to care, people do use care. So that's really good, because you can then send all your promotion, your prevention messages, and then in the long run, you make savings. And that's also something that drives our economy. But it was not just giving people financial access. We were forced to reconstruct everything, so we had to put up the infrastructure. Since the last 20 years, 94, we built 10 new hospitals. Rwanda is a small country. I don't know if I've said it. It's a small country. We have, in total, 40 district hospitals, so it's only 26,000 square meters. And with the 40 hospitals that we have, we can cover the country. But we also built health centers. We built 300 new health centers, which makes that we moved from 188 to 488 health centers, making it accessible to people. So we were able to reduce the time for them to reach any health facility. We also built up district pharmacy. We also put up infrastructure for them to be able to communicate. We had to staff also those health facilities. Staffing those health facilities needed to produce doctors, because most of the doctors either were dead during the genocide or had left the country. So we went from 112 doctors in 1994 to 690-something. So we multiplied the number of doctors by almost 7. We produced midwives. There were no midwives in Rwanda. There were no midwives in 94. So now we have 600 midwives, and we continue producing them. We also put in place, nurses used to be trained just at the secondary level. Now we are training them at the university level, so they do 3 years in university. And we have produced, since the last 5 years, we went from 500 to 1,500. So and all that, it's an effort to try and get services, care to our people, because that's the only thing that you can give. We are very privileged to be healthy, educated, and all those things. But a lot of people do not have the same chance, the same luck that we have. So, and all those things help us also to build an infrastructure to be able to care for HIV patients. I remember when I was doing my training in med school rotation, we used to see people who were completely emaciated, who could, an adult person who could go from 80 kgs to 20 kgs lying in a bed. And we had nothing to help that person. There was nothing there. We barely had the test to test and know that it was HIV. It was in early 2000. It's not that far away. I'm not that old. Yeah, and I remember it like yesterday. And the funny thing is that now, today, all the students who are being trained do not remember. They don't see such patients. They don't see those patients. All the opportunistic infection that we used to see, the chronic diarrhea, the tuberculosis, they don't know what it looked like. And that happened within 10 years. With the support of a lot of partners, but partners who were coordinated to be able to respond to that epidemic. Now the coverage in Rwanda for the HIV treatment, because we're not talking about AIDS anymore, it's HIV, it's 80% with the new guidelines. Because 2 years ago we were at 90%, but when WHO changed the guidelines to make more people eligible, we dropped to 80%. But still it's good because we are reaching more people. We have PMTCT, and PMTCT is something that holds me somewhere, because after working in pediatrics, I went on to work in a project that's called Amata. Amata in Kinyarwanda means milk, but it was also a clinical trial when we were receiving the first drugs for preventing mother-to-child transmission. So people didn't have access to treatment then, back in early 2000. So what we did, we had a group of women to whom we gave treatment to make the proof that it really works, because we were among the first people who did that. Give them the drugs and tell them to breastfeed their kids. And we were following 600 people. And it did work. And that study helped change the guidelines internationally, and that was fantastic. But what I remember most from that was a young, I don't know how to say it. There was a mother who was in her 40s. There was his daughter who was in her 20s. The mother, let's call her Awa, who was 40s, had HIV and infected her kids when she was giving her birth. And now the kid was also pregnant. And she wanted to have a baby. It was also a baby girl. And she was saying, look, the first generation is HIV infected. The second generation, will our third generation be infected? And they came to our program. And we put them on treatment and followed them up. And fortunately, the third generation was HIV-free. And those things, beyond all the numbers, beyond all the programs, beyond all the statistics, it's people's lives. You change people's lives because of the work that you do, and that's fantastic. When the first orator said that she does the work that she enjoys, I mean, there's nothing better than that, to do things that you really enjoy. So the baby was born HIV-free. She entered our vaccination program. And I must say that in Rwanda, we have 12 different vaccines that all our kids receive. That's very unique in Africa, 12 different vaccines. 6 of those 12 were introduced less than 10 years ago. And the coverage is usually above 90% for all the vaccines. And that's what explains, all those things explain how we can achieve a life expectancy that's now at 65 years old, but it went up from 40 years to 65 in 16 years. So in 1996, it was 40, the life expectancy of Rwanda, and in 2012, it's 65. And we're trying to improve. As we said, the objective is to have 80 or 90 years of happy and productive life. So people, when they hear all the story, they talk about the Rwandan miracle. It's a miracle? Is it a miracle? I don't know. But what I know is that there are people who are out there who have sleepless nights, who work day and night to make that happen. And they work to make that happen because we set as ourselves a deadline. We have this vision that we call Vision 2020. In 2020, we want to be a middle-income country. A middle-income country meaning that we want people to be healthier, we want people to be more educated, we want people to be more prosperous. So everything is built around that vision. And around that vision, we have also another strategy that we call the Economic Development and Poverty Reduction Strategy. That's also a frame for everything that we do. All the health sector align their strategic plan to those two documents. Everything is around reducing poverty, giving people better care, better lives as well. So that's the vision that's pushing us and that people call probably the miracle. But the miracle I see is to work every day when you wake up thinking, I can change somebody's life. I can make a difference. I can make him healthier. I can make him more educated. I can give him more opportunity. And that kind of change can happen everywhere. It can happen anywhere. The only two things that I see that are mostly important to make it happen is first, to work together as a group, because we are stronger, we are smarter, we are better when we work together. And second is to have each and every one of us own the common goal. If we own the common goal, if we feel that we belong, and that's one of my psychiatry professor told me, he said, you know, Patrick, what's one thing that's the most important for any human being is to belong to something. If we feel that we belong to a great project, if we feel that we belong to a country, if we feel that we belong to a continent, we can own that common goal and make things happen. So before closing here, what I would like to urge you all who love Africa, who know Africa, I would like to tell you to think about contributing, to think about changing people's lives, to think about helping this train that is movement and make things happen. Don't just watch the plane taxiing to take off. Be part of that plane. And if you want, come along with me. I'm flying back tomorrow. Thank you.